are here today, it is probable that you or someone close to you has been advised to have a fine needle aspiration or an FNA of their thyroid gland. The thyroid gland is a soft tissue organ which lies in the front of the neck, in front of the trachea or windpipe. It has two small lobes resting on either side of the windpipe, which are joined in the center by a thin bridge of thyroid tissue called the isthmus. The thyroid gland is very important because it produces hormones which control the metabolism of the body. FNA is used to take a small sample of thyroid tissue using a very small needle. The most common reason for being advised to have an FNA is to further evaluate a thyroid lump or nodule which has been discovered either through palpation or through investigation such as ultrasound or CAT scans. The FNA is good because it has a high chance of excluding malignancy, which, although uncommon with thyroid swellings, is important to diagnose early, as early diagnosis often leads to successful treatment. The FNA can be done as a day procedure, so an overnight stay in the hospital isn't required by most. It usually takes half an hour, and after a short period of observation, you can leave the hospital. You will not require a general anesthetic to have an FNA, and it can be done with or without a local anesthetic. Blood thinning medications, you must let the department know, as these may need to be stopped for a few days or the dose may need to be adjusted before the procedure. It is important that you consult both the doctor and the center with regards to the medications you're taking before making any changes to your medications. You can continue other medications and physical activities as normal before the procedure. The FNA can be done in some cases without an ultrasound, although more commonly one is used to help the medical personnel get the best possible sample. Ultrasound will usually be carried out by a trained technologist, radiologist, or a physician. Very often, another specialist is present during the procedure who will quickly examine a sample of the aspirate under a microscope to ensure that the sample is adequate. These samples are quickly dried and stained, and an adequate sample must have a certain amount of thyroid tissue or thyroid cells in it. Very often, more than one sample will be taken to be sure an adequate sample has been aspirated. So you therefore may get 2 or 3 small sticks with a needle to do the aspirations. If you have more than one nodule requiring examination by FNA, the procedure may be repeated on other nodules. Although, as mentioned, a sample will quickly be evaluated during the procedure, a full report won't be available for a few days as further testing may be required. Once the procedure is finished, the needle puncture site will be compressed for a few minutes by the doctor, and an ice pack may be placed on the front of the neck to help reduce swelling and bleeding. So what are the side effects? That's everybody's concern once they're having a procedure. FNA of the thyroid is in fact a very safe procedure and is of low risk for many people because the needle used is so small. The most common side effects are minor pain, swelling, or bruising at the site of needle insertion, which improves within 48 hours. It is best to avoid aspirin for pain relief unless you're already taking aspirin for another reason, simply because aspirin can increase the risk of bleeding. The doctor should advise you what painkiller you can use. Rarer side effects may be voice change, severe pain or swelling, and difficulty breathing or swallowing. If any of these happen to you, you should contact the center where the procedure was done. And if you experience difficulty breathing, which is significant, you should go to the nearest emergency department. It is not uncommon that FNA yields an uncertain diagnosis. In these cases, you will probably be advised to come in for a repeat FNA at a later date. Very rarely, FNA can cause a temporary increase in thyroid function, which can cause symptoms like increased sweating or racing heart. If that should happen, you must consult your doctor. After having an FNA done of your thyroid gland, it is advisable not to engage in too strenuous activity on the day of the procedure. This is simply to reduce the risk of any small bleeding into the thyroid gland. Of course, an important question is, suppose you don't want to have an FNA, what are the alternatives? You need to discuss the alternatives with your doctor. They may include watchful waiting and repeat ultrasound scans, which will be scheduled under the advice of the doctor. Or if FNA is a high risk for you for some reason, an open thyroid biopsy. However, should you choose not to have a biopsy in any form, it does, however, increase the possibility that you may be having a potentially treatable and serious lesion that goes undiagnosed. I hope I've been able to help you in understanding the FNA of the thyroid gland procedure. So I want you to just relax and be assured it is a very common procedure, usually very well tolerated. Thank you for joining us today on this series. Goodbye. I'm Dr. Kitty.